In Fairfield County, something new comes across my desk every day. Crimes are committed, cases are solved, and a community is made safe by the hardworking employees of the Fairfield County Sheriff's Office. Welcome to This Week with Sheriff Dave Phelan, a weekly program here on LSN. We're also carried by a number of the radio affiliates here in Lancaster. Do appreciate you, the viewers and listeners that join us each and every week. Our executive producer, Kelly Roberts. This show is actually taped at Fairfield Christian Academy. Do appreciate J.T. Burton and the students that helped put this program together. We've got a great program coming up for the next 2 weeks. We have with us Dr. Thomas Voin. Doctor, well, first of all, tell us a little bit about yourself.
Well, I'm an Ohio State University graduate.
Congratulations.
Thank you. And I did a residency in Michigan at Midland Hospitals in family practice. They're a University of Michigan affiliate hospital.
Okay.
And from there I went into emergency medicine as it was not actually a specialty yet. And went to Traverse City, Michigan. I was there for 4 years and director of the emergency room up there, and we became a trauma center while I was there. Then went to Ann Arbor for 2 years and was director of a new facility there with the Ann Arbor group. And after that, in 1984, I came to Lancaster in the early 80s and was here for some 24 years, director of the emergency department here at Fairfield Medical Center. I then thought I retired because I was coroner and jail physician too. And I got a phone call and started doing hospice medicine, attending hospice with Fairhope Hospice, and subsequently became boarded in hospice medicine as well. I also am actively boarded in emergency medicine and family practice, and last year I got my boards in addiction medicine as well. So
you wear a lot of different hats.
I do. So I actually have forensic medicine as well, so I actually have 5 different specialties, which is unusual.
Is there one area that you enjoy the most, or is it just?
I still love ER. It's on the edge, and I'm, thank you God, I'm good at it, and I enjoy it. And I certainly enjoy hospice. You wouldn't think you would enjoy hospice, but the families and the patients are so appreciative of what we do for them in their last days of life or weeks of life. And so it's actually many times very rewarding.
I would think so. I would think because, you know, there can be no more difficult time for many families during that time, and certainly for the individual going through it. So what they do at hospice and what you do is wonderful. So it's a great facility, and we're fortunate to have one right here in town.
We are, and it's we're 3 counties wide, and it's a team effort, and the team is awesome. The hospice team includes physicians, of course, but it includes nurses, nurses' aides, social workers, pastors, physical therapists, music therapists, and even massage therapy and aromatherapy at times. So, and pet therapy. So it's a broad range for those people who are in their last
How
days
long
of
has
life.
hospice been around?
Hospice, interestingly, came into being in the 70s in England.
Really?
And then it evolved here to the U.S. and became much more active in the 90s. And now it's been in a growth phase from the 90s to now. So when I joined hospice 10 years ago, we had some 35 to 40 patients. We now carry 150 patients at one time, 140, 150.
And how many people are housed at the residential center here in town?
Yes, we do have Fairhope Hospice Center. It's on 30-some acres of beautiful terrain. We have a butterfly garden. We have waterfalls. It's very peaceful with the woods around us. And we have a 12-bed unit there. So there we have some patients who have special needs, maybe medication adjustment or excessive pain, and we're trying to get medications controlled. We bring them in there for 4 to 5 days, get things controlled, and then hopefully get them back to their homes or sometimes an extended care facility, whatever the case may be. But the patient's wishes always come first where we go with them.
You know, this past weekend, Loretta and I went to visit a friend that is terminal and at home, and it's kind of just gotten the news. And it's interesting how people process that.
Yes.
And I bet you probably find a lot of different reactions when people find out they have a terminal illness.
We have lots of different reactions and lots of different family reactions. One beautiful thing about the Fairfield Hospice building is there's gathering areas. We have 3 different separate gathering areas for families if there's lots of family there. Some good stories about hospice is we've had families who have been separated for 10 plus years who may have had differences that they didn't resolve, and I call us the demilitarized zone. We're the neutral zone. You can come there and drop your defenses and reunite, and we've had many families reunite that have been separated for 10 to 20 years, so that's a very beautiful thing when that happens.
Wow, wow. So lots of good things going there. Now, you're the coroner.
I am the Fairfield County Coroner, have been so since 1991.
And for some of our viewers and listeners, what does the coroner do?
Okay, the coroner, all states.
I mean, we know what it does on television,
That's right.
but as far as what we see in
I'm going to talk about
reality.
Ohio.
Okay.
In Ohio, the coroner has to be a physician or a dentist, and it's an elected position.
Okay.
And it's kind of unique because, for example, if one of the commissioners would become ill or resign for a reason unbeknownst, the coroner is appointed to the commissioner slot until that is filled by another appropriate person.
Oh, I didn't know that.
It is interesting.
Okay.
So, but the coroner, in simple lay terms, you're the medical policeman.
Okay.
Now, you have your detectives in your bureau and your deputies, and they are investigating death, and I'm investigating the medical quizzing of the death. How did this happen? What was the process? What was the pattern? And gather all the information I can medically to basically make your best judgment of many times, which you can get very exact, and sometimes it is just that best judgment. We even have on the death certificates, sometimes we have a category called indeterminate, and there's actually 5 different categories. You have natural death, which is like someone who has a heart attack and dies from a heart attack, and that would be a natural death. You have accidental deaths, which can be an auto accident, a bicycle accident. It could be somebody falling down the stairs, getting a brain bleed and dying. And then you have homicidal, a death caused by somebody else. And then you have suicidal, which is always not a fun time for anybody and very tragic. And then you can have undetermined if you can't come up with a definite decision at that time. And that's very few that we use that category, but we sometimes do.
And what type of deaths does the coroner get involved in, and what type of deaths do you not get involved in?
Okay. Basically, a natural death, someone being cared for by a physician actively, we usually would not get involved in. We do have a medical personnel in the hospital call us on a death that happens within 24 hours of admission to the hospital. For example, you may have a cardiac death in the emergency room. You may have a operative death from anesthesia. You have somebody who's 90 years old who broke their hip, who really was not a good anesthesia candidate, but it's either that or they're bedfast and will never walk again. You may have something like that. So anybody in the first 24 hours we review. Then otherwise, anyone who has fallen with a death, and actually you may have a heart attack and fall, and that may not qualify, but if you fall, hit your head and have a bleed, then that would end up being in the accidental category. I can give you a recent example. Someone who is in an auto accident 6 months ago and breaks 5 ribs and is elderly and never gets back to what we call their medical baseline, where they aren't walking like they used to, very short of breath because of the rib pain and those kinds of things, and then they would get pneumonia and die from pneumonia. The pneumonia is a natural process. However, we would surmise that and induce that the pneumonia probably would not have happened had they not been splinting from the rib fractures. So that actually could qualify as a accidental death, even though the rib fractures didn't kill them in the first 2 or 4 weeks of injury.
That's interesting. So now, how long have you been the coroner?
I have been the coroner since 1991. I've been a deputy coroner for more than 40 years with coroner experience as well. So it's for over 40 years I've been either a deputy coroner or a coroner.
Biggest change that you've seen?
The biggest change is people are expecting more, and they want everything done more thoroughly, which I'm sure you see in your field as well.
And I think a lot of times what we see is the expectations are different because they watch TV. They always think there's going to be DNA, and they always think there's going to be some forensic ability to solve crimes.
Yes. So we do use DNA, but not that often. Right. I tell people what you see in an hour on TV is, a week in the emergency room, and what you see on an hour on TV in the coroner life is probably a year in the coroner's department. We do have challenging cases, a few a year. Most of them are relatively straightforward, but we do 30 or more autopsies to help determine the exact causes of death when necessary.
Now, the other thing, and we could do an entire program on this, and I know you've seen this firsthand, is certainly the overdose deaths that we've seen, not only in Fairfield County, but Ohio, across the nation.
Yes, the overdose deaths are a tragic situation. We have more deaths of young people from overdoses than motor vehicle accidents, and this has just been a case in Ohio, and it has spread across the nation and even around the world. Canada is not immune, neither is Europe as well. It's a social issue that doesn't just touch the person who's involved with the drugs or the addiction, but everybody around and the community that they're in, as we have seen here in Fairfield County as well.
And certainly that is something that, at least from my perspective, that probably we've started to see that really the numbers move upward in the last, 6, 7, 8 years.
Yes. I can give you an example. One county, Butler County in Ohio, in April had 21 drug overdose deaths alone. Wow. We have had probably 10 this year, had 18 or 19 last year, I believe, if I get that correct from memory. But it's a tragic, unfortunate deal. Another thing that's happened with the heroin, which is what people go to because it's cheaper and they can't afford the Oxycontin and the Percocets, is it's getting laced with fentanyl now, and fentanyl is very potent. The Mexican cartels make it because it's cheap, and when they can't get heroin, they add it to it, and it unfortunately causes more respiratory depression and deaths that way.
We're just about out of time. I'd like to have you back next week, and we can continue this conversation. Certainly, since you're the physician overseeing the patient care within the Fairfield County Jail, a lot to talk about, but we'd like to have you back next week.
Thank you.
Dr. Thomas Voin, wonderful physician, and just does a terrific job. Wears a lot of different hats in a lot of different areas in the medical care of patients within our jail and certainly throughout our community. The clock on the wall says we've got to go. Until next week, same time, same place. If you're driving, buckle up, and we'll see you right here next week. God bless.
These waters were woven into the culture of Native American tribes. The descendants of the early Europeans built a business here based on agriculture. And today, this unique destination in the central Ohio countryside comes to life with stories and memories centuries old. The Fairfield County Historical Parks invites you to amazing Rock Mill. Above the falls of the Hocking River Gorge, here together, nature and man have created some truly American stories that you'll want to experience with the entire family. Visit us or learn more about Rock Mill and the largest wooden water wheel in the nation at historicalparks.org.